You've probably heard of ABCs for prioritization questions, but I promise you that the mnemonic that I made is going to help you get every single question on prioritization right on the NCLEX. That mnemonic is ABC flash. So I want you guys to remember this mnemonic when you guys get prioritization questions on the NCLEX, like which patient should you assess first. ABC flash. So acute before chronic. Acute problems will always be more important than your chronic problems. For example, if your patient has developed acute cholecystitis, this patient is going to take priority over your patient coming in with COPD because it's a chronic issue, even if the patient has dyspnea. And NCLEX tip, words like acute, new, or sudden onset are going to indicate that this is something new happening now. Your F stands for fresh post-op. So within those first 12 hours, that patient will always take priority over any other patient. Your L stands for lab abnormalities. A lot of times on the NCLEX, you're going to see abnormalities like a low or really high potassium. That patient will take priority. Or L for low blood sugar. Your hypoglycemic patient will also take priority. A stands for altered mental status. So if your patient's altered, confused, they're lethargic, they're drowsy, this is something neurologic happening. Now, S stands for sepsis. If you have signs of sepsis, your patient is tachycardic, your patient is hypotensive. This is a red flag. Patient has an active infection, like patient came in with appendicitis and now they have a rigid, board-like abdomen. That patient now has developed peritonitis. It's a life-threatening complication. That patient is also going to be the most important patient you want to assess. And then your H stands for hemorrhage. So I want you to remember, if your patient's actively bleeding, this patient is going to take priority. So to summarize, always look at the scenario. Try to ask yourself which one of these patients is experiencing something life-threatening or a complication. Oftentimes, they're going to present to you patients that have signs and symptoms that are expected with the diagnosis that they're coming in. So weigh that all out, and I promise you, if you remember ABC flash, you will never get a single prioritization question wrong on your NCLEX. Save, like, and share with your friends.